Canada's most populous province is taking drastic action to try and shore up its healthcare system. The province reported more than 4,200 new cases of COVID-19 yesterday, and that number grows. As it does, so do the number of patients needing intensive care. Laura McQuillan on the story for us once again. Laura, let's talk about those patients in critical care. What's the latest there?
John, what we've learned in the past day is another 77 people have been admitted to intensive care. That's a record number for one day during this pandemic. And now there are 572 COVID patients in intensive care units in Ontario, far exceeding any number we have seen before in the pandemic, which is what has led the province to make these emergency orders as it did last night. One, enabling hospitals to transfer patients elsewhere, to other hospitals, to field hospitals, without their consent, if it needs to do that to avoid being overwhelmed as a hospital. The other emergency order enabling the redeployment of nurses and other healthcare workers from community care organisations into hospitals, so hospitals can then move their own staff into intensive care units, because that burden they're seeing now is only going to grow. That's the warning from doctors, it's the warning from the provincial health minister as well, as we spoke to her last night. And when we spoke to her, she also pointed out that Ontario is cutting most of its surgeries. Everything that's not an emergency will be put on ice. All of this intended to free up beds, free up staff to care for the people who need those beds. But doctors are really worried, as you just heard there, about what is going to happen next. I want to show you a tweet that we saw just a short time ago from one medical expert. This is Dr. David Yerling. He's the head of clinical pharmacology and toxicology at Sunnybrook Health Sciences Centre in Toronto, warning with that redeployment of staff. Let him point out that most doctors have nothing resembling the skill set of a critical care nurse and are genuinely terrified by the prospect of being asked to function as one. He has concerns over this plan. Other doctors telling us they are worried they're going to have to make some tough decisions about the care they can give their patients. Who can get that care if this strain on intensive care continues? One of those doctors we spoke to is the head of the Ontario Medical Association. She told us what she's thinking, what her colleagues are thinking. Take a listen.
The idea that we may have to triage access to care based on anything other than medical need and patient wishes, that's not what any of us signed up for.
And in fact, as we heard Dr. Michael Warner just in the opening of the show this hour, John now calls for the federal government to intervene to get it resources into these Ontario intensive care units from other provinces, because doctors are so worried about what might happen next.
Meanwhile, Laura, a lot of confusion over the latest steps of Ontario's vaccination plan. What are you learning about that?
That's right. A lot of people have been reaching out to us saying, okay, I'm 18 plus, I live in a hotspot, the province has said I can get a vaccination. What next? And the answer is Toronto and Peel still have to figure out all the details. We're learning this was just sort of dropped on them by the Premier when he announced it a few days ago. If you go to the provincial booking website, you cannot book there. Toronto and Peel don't have their own booking sites available at this point, so they have to create those. They have to come up with the plans for these mobile units, for these pop-up clinics. In Toronto, a couple of neighbourhoods are seeing pop-up clinics. You're looking at one yesterday in Thorncliffe Park, open to people 18 plus in that community or the neighbouring community. Other people who don't live there, who don't have ID showing they live there, are being turned away, and there's only a limited number of doses. The rest of the province, everyone else in a hotspot, wondering when they can get their shot. We will bring you those details when we get them, but we're hearing warnings from Toronto and Peel and from the Ontario Ministry of Health that those details are yet to be bashed out, John, so it could be some time before anyone 18 plus in a hotspot outside of those areas already doing it can get their shot.